Good afternoon. Thank you for inviting me to speak today on behalf of many families in the Plymouth Canton Community School System. My name's Mike Peters. I've been a resident of Canton since 2004. I have three children, three sons, aged 18, 15, and 12. They have all attended PCCS or have graduated from PCCS, and they've been there since kindergarten, so we've been with that district for a long time. I don't want to be redundant with what Kelly said earlier, but we have had multiple postponements of in-person learning beginning from October, and there have been about 4 postponements. A lot of them came at the last minute without any discussion, virtually no transparency in how some of these plans have been deferred. It's been very frustrating, particularly since I have a son. My 12-year-old has an individual educational plan, and he has been dubbed a visual learner. He is not somebody who can sit in front of a screen for 6 hours a day and absorb the material, and my wife spends about 20 to 30 hours a week teaching him. While he's been assigned a resource room teacher to help, she's overwhelmed by the people in his class. And from what I understand from talking to other special ed teachers in the district, the majority of these students are failing. They are just flat out failing because they are able to retain a fraction of what they're taught in front of a screen as opposed to a virtual environment. I am modifying the testimony I sent earlier. Bear with me just for a minute. We have formed in our community a support group, and we've tried to encourage our parents, many of them who we've never met in person, to help their kids cope with the remote learning. Yesterday, a 17-year-old from our district committed suicide. This was preceded by weeks and months of pleading from this person's mother to address the issues of mental health, of isolation, of the substandard learning experience, and his calls went unanswered. And now he is gone. This mother had the courage to call my wife this morning and plead that we speak to this committee on his behalf. It's a tragic case of the mental health of the students almost going ignored. We do have an epidemic of mental health going on in these areas where remote learning continues. And just because it's harder to measure doesn't mean that it doesn't exist. We've looked in PCCS, there have been efforts by the administration to bring the kids back to school to in-person. These efforts continue to be met with resistance by our Board of Education and by the local teachers union. They have publicly stated, even though we've got evidence from numerous medical professionals, the advice from these professionals is very flippantly dismissed by statements like, "I still don't think it's safe," by people who have absolutely no training in the medical field. We have also experienced various board members coming up with their own metrics. I work for a large corporation, and that would be unheard of. That would be unfathomable to do that, to basically promote an agenda. And these metrics, as you would suspect, are highly biased against returning to school. At present, there is just the dismissal of science, the continued reliance on this unsubstantiated data from unqualified sources, and a board that has failed in their oversight responsibility. We are at an impasse right now, and we really need to have some intervention to follow the science and get these kids back where they belong. So to the Michigan senators in this audience and to Governor Whitmer, I implore you to please intervene on behalf of our students, much like some other governors and mayors have done on both sides of the political aisle. The process right now of staying on the sideline and letting school boards and administrators dictate how this is going to proceed just is not working. We need help, and we need your help right now. I hate to say it, but the time has come to pick a side. You're either on the side of these students or you are not. And I implore you and I plead with you to be on the right side of this debate. Thank you very much.